Well, I appreciate the opportunity to talk. My name's David. I'm the public educator for the Canadian Mental Health Association Middlesex in the London area, and just have the having the opportunity to talk today about some of the ongoing mental health challenges around the international pandemic, COVID-19, and some of the unique challenges that some of our citizens of all ages are going to be experiencing. I guess one of the first things that we need to sort of pay attention to is the fact that, this situation is, we've never experienced before. So with that is going to come a natural and normal reaction in terms of feeling stressed and quite anxious over issues that we have no sort of prior experience with. So first and foremost, what most people are going to be going through is absolutely normal, okay? But with that comes some, important strategies and things to implement in order to sort of minimize or at least reduce some of those levels of stress and anxiety. And as important as it is to stay updated with pertinent information, you really need to consider a couple of things with that specifically. What sources are you accessing? Are they reliable? Are the information that you're getting, science-based and coming from, areas on whether it be the internet or news outlets that you can rely on to be truthful, okay? And the other part too is that as much as we like to get that information to hopefully deal with some of our concerns, stresses, and anxiety, it is not a good idea to be consuming it for mass periods of time over the course of the day. So checking in once or twice at the most, but not sort of having it constantly running all the time, whether your TV be on one of the news networks or you're constantly checking social media outlets for updates and information, really is not in a person's best interest who's trying to cope with some of these uncharted waters, if you will, okay? There really needs to be some opportunity to minimize the amount of time you are spending on social media, okay? All the scientific research that it's already a significant source for people's stress and even affects their mood to a certain extent. So during this period of time, it's another opportunity to sort of see if you can't reduce the level of utilization with regards to social media. Now, having said that, though, it's an important ability, though, to sort of maintain some social contact, especially if you know somebody who is somewhat isolated, whether it be self-imposed or whether they're actually have come down with the virus and now is in some type of quarantine. So you need, again, to balance that and judge how are you using social media and whether or not it's being used in a positive way in order to try and support somebody who is maybe struggling and feeling a little bit isolated and alone, okay? For those people who you may have some contact with that are really starting to get on these negative narratives and spirals, thinking that the glass is always half empty and has these catastrophic or apocalyptic notions about the future, again, you are probably going to be served best by not spending a lot of energy and time trying to convince those folks of a differing outlook. And in turn, it'll just end up creating some negative thoughts and processes around your own perspectives and views, right? It's important to try and remember we all have these built-in resiliencies, and to take a look at different times in our lives when we've had to struggle with very challenging circumstances and see if we can't implement some of those strategies that got us through those other difficult times
during this period of time, realizing and not to be naive that this is a unique circumstance. Absolutely. People are thrust together that for long periods of time that normally wouldn't have that particular dynamic exist. People would be going to school, going off to work. So again, those challenges are unique given this particular circumstance. Okay. If there are legitimate and significant problems that are really weighing heavy on individuals, it's best to try and see if you can't prioritize and structure through those problems in such a way that you can identify what you have some significant control over and what you don't. And that's easier said than done. There's lots of different techniques and strategies. I would suggest, excuse me, a great website to go on is CMH's website. They have a lot of excellent, very particular strategies and techniques to sort of look at breaking down particular problems that people might be dealing with in a way that allows them to sort of, first of all, identify what they have some influence over and spend less time on ones that they don't in such a way. Okay. Again, if you are preoccupied with a lot of significant worries and challenges, sit down and see whether or not some of those fears and worries are legitimate. I mean, sometimes when we're really stressed and anxious, can create problems that don't actually exist when we take a finer, sort of more critical look at them. And it never hurts to run those particular issues by somebody that you have a trusting relationship with, that is doing fairly well in with their own experience with regards to the present circumstance, and have them sort of bounce back some of what you're experiencing to see whether or not it's as a big an issue as you might be making it out to be as well. Okay. One of the last and probably most significant issues to consider also too is the level of self-care that we need to be prioritizing over this period of time. And again, this is not significant information other than the fact that sometimes we'll get out of our normal routine. So sleeping patterns are really important to maintain. Making sure that we're eating nutritious meals as much as we can. And also, too, be very, very mindful of any sort of increased use of caffeine, alcohol, any substance that could be significantly detrimental over the short term or even long term, depending on how long this situation goes. Okay. And really important to maintain some level of physical activity if at all possible. And again, that's easier said than done with some people's circumstance. But even getting out for a brisk walk, again, as long as we're respecting the guidelines set out by the public health officials in terms of that physical distancing and making sure. But again, a good walk, someone from the neighborhood, I mean, as long as you're maintaining that 6 foot or 2 meter distance. And these are all things that can really help with regards to trying to minimize or at least keep some semblance of control and monitor the level of anxiety and stress. The important thing to consider too is if you are feeling overwhelmed, there are still resources out there that can be of some assistance, like the Reach Out line here at CMHA Middlesex, CMHA Elgin, and also CMHA Oxford and Woodstock. Please, if you are suffering or feeling overwhelmed, pick up the phone and talk to a mental health professional. We've also got the support line that is up and running still here at CMHA Middlesex at 519-601-8055. And the reach out number again, sorry, I didn't give that to you. It's 519-433-2023. So we are running as many essential services here at our agency as possible to help those individuals who really do need some support over these during this trying time.